Everyone, welcome back to my channel. Today I'm going to discuss a very important topic from infectious disease part of the pediatric chapter from Toronto Notes 2025 edition. Okay, so let's start with the topic, that is fever. First of all, we should learn the definition of fever. Fever basically means is when the body temperature rises 30 more than 38 degrees centigrade or more than 100 degree Fahrenheit, 100.4 degree Fahrenheit, orally, either we check in the mouth or rectal. So oral rectal temperature if rises above 38 degrees centigrade or 100.4 degree F. Okay, so fever without a source or focus, that is, what does it mean? It means the acute febrile illness, typically less than 10 days duration, with no identifiable cause of fever even after careful history and physical examination. So, there is some fever of the child is suffering from some fever like illness less than 10 days duration, but we are not sure of the cause. Okay, even after history and examination we cannot identify the cause. So that is fever without a source or focus. All right, this term is called fever without a source or focus. Okay, now the next thing we need to know is fever of unknown origin. Unknown origin fever means daily or intermittent fever for at least 2 weeks. Okay, so every day the child is suffering from fever or intermittent fever that comes and goes for at least 2 consecutive weeks of uncertain cause after careful history and physical examination and initial lab assessment. Alright, so we have read basically three terms regarding fever. First is the fever itself, second is fever without a source or focus, and third is fever of unknown origin. All right, so difference between fever without a source of focus is less than 10-day duration, no cause is identified, but fever of unknown origin means daily fever or intermittent fever and continues for at least 2 weeks, means 14 days, and we don't know the cause in this case as well. And even after history examination and lab assessment, we cannot identify the cause. Okay, now the causes of fever. Etiology of fever is very important to know. Of course, the most important etiology is infectious causes. Okay, so maybe some causes of infections like in the brain, like CNS infections like meningitis, ear infections, middle ear infections, especially upper and lower respiratory tract infections can lead to fever, like pneumonia, bronchitis, etc. And genitourinary infections, so basically the whole systems of the body, if they get infections, if we get infections anywhere, that can lead to fever, starting from the CNS, then ears, then upper and lower respiratory tract, the genitointestinal gastrointestinal tract, the genitourinary tract, skin infections, soft tissue or bone infections, as well as the joint infections. All right, the next thing is inflammatory causes. Inflammatory causes basically mainly autoimmune in nature, like for example Kawasaki disease, juvenile idiopathic arthritis, inflammatory bowel disease, SLE, etc. So inflammatory causes of fever include basically Kawasaki disease, okay, then juvenile idiopathic arthritis, inflammatory bowel disease, SLE, then malignancy, childhood cancers like leukemia, lymphoma, neuroblastoma, that can also present with fever. Okay, and the miscellaneous causes we need to remember are certain drugs and toxins that can cause fever as a side effect. Post immunization, after the vaccine is given to the child can suffer from fever. Familial dysautonomia and factitious disorder. Okay, factitious disorder is a psychiatric condition, okay, in which there is no gain, but but he is saying that I have fever and this suffering from fever, but there is no gain involved. Okay, then diagnosis of fever. History is very important, of course. We have to know about the duration. Since how long the child is suffering from fever. Okay, what is the maximum temperature recorded? What is the pattern? Is it continuous, intermittent, on and off? What time of the day is there? Associated symptoms with it? Exposure to any toxins, allergens, drugs, constitutional symptoms, recent use of antipyretic. When was the last time antipyretic was given? Tylenol is given to the child, but when was the last time it was given? Ethnic or genetic background, daycare, child goes to a daycare, child is in contact with the sick people, travel history, tick or other insect bites, and age of child. Okay, then after history, a thorough history, we need to do the physical examination of the child to rule out either is a toxic cause or the non-toxic causes. We need to check the vitals of the child, the growth and parameters on the growth chart, her weight and height and head circumference, all those things on a growth chart. Have to do examination, complete one, to identify any focus of infection. Okay, because remember we saw that even the skin infections, the bony infections, the joint infections, and can also soft tissue infections, everything can cause fever. So we need to get a good detailed head to toe examination to identify the focus of infection. All right, now some investigations that we need to do, guided by history, examination, and clinical suspicion. We do investigations accordingly. Okay, now, the next thing is the Rochester criteria developed to identify the infants less than or equal to 60 days of age with fever at low risk of serious bacterial infection. We don't need to know this criteria, that's not important. But the thing that is important to know is what is the various causes of fever at various age groups and what approach we are going to follow. Okay, so if the fever happens in a child less than 28 days old, is a neonate. Neonate is less than 28 days old, so we have to admit the neonate. Full SWU, that means a complete septic workup. Okay, and we have to give an empiric antibiotics too. And what are the empiric antibiotics? Okay, and so empiric antibiotics are basically according to the practice variation. Okay, so basically whatever is used in the in that particular hospital, we have to give those antibiotics. Okay, then the age is 28 to 90 days, so it means if it's less than 1 month, we have to do all these things. We have to admit, we have to take it serious, we have to admit the child, we have to do the full septic workup, and we have to give empiric antibiotics according to the guidelines. And then if the age is between 1 to 3 months and the non-toxic causes are there and their low risk criteria is there, then we have to do the partial septic workup. And what does it include? The partial septic workup, as already you can see in this table, septic workup means complete septic workup, partial means we do the blood culture sensitivity, we do the CBC differentials, we do urine examination, lumbar puncture, chest x-ray, stool, and if there are GI symptoms. So we need to do the partial workup. Okay, then after that we have to give antibiotics. May consider treating as OPD or outpatient department, or consider observation without antibiotics. Okay, either antibiotics, either no antibiotics, but depends upon the results of this partial septic workup. Okay, all other causes, admit, we have to admit the child, do full septic workup, and start empiric antibiotics. Okay, now if the child age is between 3 months to 3 years, so what happens with the, if we find any toxic cause? So for toxic causes, we again do admit the child, full septic workup, and start empiric antibiotics. Okay, and for non-toxic and we don't know any focus of infection, non-toxic and no focus, So if the temperature is more than 39 degree, we have to do urine routine examination and CBC. So basic two tests are done. First one is urine examination, and the second one is CBC, complete blood counts. Okay, so if the results are WBC count is more than 15, then we have to do blood culture and sensitivity. If the WBC count is less than 15, we do the blood culture and sensitivity, but we have to do observation, and we have to just give acetaminophen antipyretic and follow up in 24 hours. Okay, so follow up is crucial here. Why we say? Because if adequate follow up is not assured, a more aggressive diagnostic therapeutic approach may be indicated. Okay, although the WBC count is less than 15, but we have to do give antipyretic, and a follow up is in 24 hours. That is crucial here. Okay, now if the WBC count is already more than 15, and then we have to perform the blood culture and sensitivity. If no source of infection can be identified, then empirical treatment can be used like amoxicillin or ceftriaxone. These are empirical treatments. Okay, and then we have to perform, along with blood culture and sensitivity, we have to perform urine culture and sensitivity, and then acetaminophen. Okay, then the next thing is temperature is less than 30 degree 39 degrees, less than 39 degree, we have to do just a routine urine examination and observation. Okay, next thing is evaluation of neonates and infants with fever. Several protocols exist attempt to identify neonates at low risk of serious bacterial infection. Okay, so the management is very important. Admit to the hospital if appropriate. We have to admit the child in the hospital if needed. Treat the source if known. Replace the fluid losses suffering from vomiting and diarrhea. Maintenance fluid needs are higher in a febrile child. Reassure parents that most fevers are benign and self-limited. Okay, antipyretics, acetaminophen or ibuprofen may be given if the child is uncomfortable. Okay, thank you so much for being with me. This is a short session, but soon I am going to do the rest of the topics related to infectious diseases. See you soon, guys. Take care. Bye for now.